Today, we share the story of a young soldier who reached out with a serious concern. Hello, I'm a 28-year-old soldier. Since around January, I've been experiencing lower back pain. In mid-February, I had an MRI at a military hospital. The results showed that the disc between my 4th and 5th lumbar vertebrae was severely herniated. The doctors said I would likely need surgery, so I took an emergency leave. I also visited a university hospital, and they too recommended surgery. They said they would remove the herniated disc by shaving off the part of the bone. But I've heard many negative stories about surgery, and I'm worried. Do I really need to go through with it? The answer is, try to avoid surgery if possible. People with disc issues, such as soldiers, students, office workers, or journalists, often share one thing in common. They can't afford to take a break from work or study. That's why they take a leave of absence to get surgery and are forced into recovery periods, including time off from school or work. Imagine a high school senior undergoing disc surgery. They wouldn't be able to sit and study, so taking a semester off becomes unavoidable. That's why we established a spine clinic focused on root cause treatment that aims to resolve the issue within just 1 or 2 days. Many people are suffering from disc problems. This 28-year-old soldier might also face challenges continuing his military career after surgery. Why? First, because the procedure involves cutting bone. Even a small amount of bone should not be removed. The spine should be preserved 100%. You should never shave, cut, or partially remove spinal joints or bones. Nor should you touch the ligaments, nucleus pulposus, or annulus fibrosus inside the spine. Preserving these structures is the only way you can move around the day after treatment. True root cause treatment involves simply removing the herniated disc fragment precisely. Endoscopic, laser, or high-frequency thermal treatments can immediately relieve severe symptoms like paralysis and nighttime pain. Here are a few examples. A former government minister had to travel far by helicopter the next day, but his pain was unbearable, so he came in for treatment. After receiving endoscopic treatment the same day, he attended all his events the next day. Even the president received endoscopic disc treatment and was able to attend his inauguration, work, and lead meetings the very next day. A university hospital professor once visited me during his lunch break. His own hospital only offered invasive disc surgery, but he couldn't bring himself to cut any bone. He received treatment during lunch and returned to work just 3 hours later. None of his colleagues or nurses even knew he had received treatment. Later, he served as both a hospital director and medical center president. At a meeting one day, he publicly said, "Dr. Sang-ho Lee fixed my back with an endoscope. Thanks to him, I can work out and go to the gym regularly." There was also a 28-year-old male nurse from Los Angeles who had already undergone microscopic disc surgery in the US. He suffered a recurrence and came all the way to Korea for treatment. After undergoing endoscopic treatment, he flew back the very next day and returned to work. You don't need to wait days to feel better. In many cases, the pain is reduced by more than 75% immediately after the procedure in the treatment room. When pain drops from 100% to 25%, people often say, "I feel alive again. That feels so much better. My leg feels light." I myself was treated by Dr. Sang-ha Shin and Dr. Junseok Bae. My herniated disc was between the 5th lumbar and 1st sacral vertebrae, and they performed the endoscopic procedure. If you're curious about our one-night, 2-day spine clinic, check out our related YouTube videos.